Dear viewers everywhere, welcome to a new episode of Outpatient Clinic. Please do not forget to subscribe to this channel and hit the like button if you can. This will help the video to spread to other people that needs it. Today we're going to talk about asthma in very few minutes. So what's the definition of asthma? Asthma is a chronic inflammatory disorder associated with episodic and reversible airflow obstruction. Your airflows in the lungs get obstructed and increase in bronchial hyperresponsiveness. So the bronchioles are very sensitive. They kind of get obstructed and you cannot breathe. You get wheezing, you get short of breath. You end up in the ER or end up needing more inhalers or nebulizer machine treatment. And also asthma presents as recurrent episodes of wheezing, breathlessness, shortness of breath, chest tightness, or coughing. All of these combined can occur in asthma attack. How do I diagnose it? I ask by the history of how many asthmatic symptoms he gets and how often they are. The symptoms could worsen at night or worsen with exercise, viral infection, especially with the flu season, allergies, or irritants. Patient may present with wheezing, and if I do pulmonary function test in a special pulmonary lab, I can tell that this patient has obstructive pattern on the test. And I also exclude other problems or disease such as COPD from chronic smoking or congestive heart failure causing shortness of breath and sometimes wheezing as well or coughing as well, and pulmonary infections or tumors or cancer or even laryngeal or vocal cord dysfunction. All of these can cause problems, but the asthma is unique. It presents with shortness of breath and wheezing and tightness and sometimes coughing. I ask of the history, the age where it started, the history of allergies, the family history, and symptoms and medication use, how often he used or she used her inhalers, and how often he ends up in the ER. And very important question I ask my medical student to learn that. Ask your patient, has he ever been intubated on the ventilator from the asthma attack? Asthma is very tricky. You could see a patient in the morning doing good in the hospital. At night, he gets or she gets very short of breath, end up on the ventilator. So long-term control, you give inhaled corticosteroids such as beclomethasone, budesonide, flunizolide, triamcinolone. Different strengths inhalers. We ask them to take an inhaler twice a day, every 12 hours, and rinse their mouths with a lot of water because they can get oral thrush from the steroids. There is another oral inhaled steroids called Advair, 50 over 100 or 250 over or 100 over 250, different strengths, and you take one puff every 12 hours. Sometimes we need oral corticosteroids, steroids, prednisone. And the way when we send them out of the hospital, we taper the dose. So 10 milligram, take 4 the first day, and 3 the second day, and 2 the third day, and 1 the fourth day. Sometimes I taper over a course of 8 days. Sometimes I write a Medrol pack. It's already pre-packaged in the pharmacy and has Medrol pack, goes directly downgrading the dosing until you stop. You cannot stop the prednisone abruptly, and it's not good for the body or the lungs, so we go taper. Short-term relief when they show up in the ER or at home, sometimes they just use the inhalers. It causes bronchodilation, so it opens the bronchi and bronchioles, give them more oxygen. So these are different from those, the top ones. These are called albuterol inhalers. They act fast and they can give relief. In the emergency room, we give albuterol nebulizer through the nebulizer machine and vapor, and that's more effective. This is a slide of normal lung and airway. This is a mucus building up here. And definitely this is inflamed lung. This is the healthy lung. This slide shows normal airway again. This is asthmatic airway. You can see, dear viewers, it's getting kind of narrow. And with the asthma attack, this becomes very narrow and no air going easily and no exchange of oxygen easily. And the patient becomes very wheezing and short of breath. This one, during the asthma attack, it's even more blocked, more inflamed, more thickened, and cannot do the exchange of oxygen, carbon dioxide easy. So this is the asthmatic during attack. This is asthmatic, generally speaking, without the attack. This is the healthy lung. You can see the difference. This shows you how you take inhaler at home. This is albuterol inhaler. This is the right way to take it, and you take 2 puffs every 4 hours as needed. This is the airway. This is the good, healthy lung with the air spaces, but she has asthmatic lungs, so she's taking the inhalers and it kind of dilate this bronchioles and help the air to go inside. What happens during the asthma attack? Again, lung without asthma, muscles are relaxed, normal airways, normal patency, normal amount of mucus. This one, lung with asthma, muscles are tightened, airways are smaller, airways swelling, mucus are plugging the airways, and lungs have difficulty moving in or out the air. This is with allergy, with pollution, with pollen, with dust, very important, and stress also. All of these are irritant and can trigger asthma attack. This is showing her with an asthma attack. She cannot breathe nicely and smoothly. These airways are constricted, are narrowed. The bronchioles gets inflated like a balloon, and she cannot exhale the air or inhale nicely. This is again the mouthpiece, the inhaler canister, and here is a sample of the inhaled corticosteroid. I want to end this showing by talking about something called cough variant asthma, especially residents, medical residents, family practice residents, or medical students listening to me, or anybody. This is the type of asthma, not the classic asthma, not the episodes where you get tightness and wheezes, but you get dry coughing a lot. A lot of them has irritants or moved from state to state with a new dog, new cat, new allergen happening to them. Allergy causes bronchospasm, causes cough. It's a type of asthma presenting with cough, not the classic asthma, and you get the asthma intermediate episodes or moderate episodes or severe episodes, but this is presenting with a lot of cough. So we tell them to get away from the whatever irritation or pollen or dust and use inhaled steroids, and we diagnose that with a methacholine challenge test. We put them in a pulmonary lab, we give them methacholine. It's an irritant, and we take pulmonary function test to diagnose the chronic coughing, asthma presenting with coughing only. Now, chronic cough can occur also from GERD, gastroesophageal reflux disease, and that could be treated easily with treatment for the GERD, such as Protonix, omeprazole, and Pepcid, and different drugs, and your doctor can distinguish. Some people get chronic coughing from post-nasal drip or chronic sinusitis, etc. I hope I gave a review of asthma. So if you are asthmatic, get away from smoking, get away from dust, take your inhaler everywhere, keep it handy. Try to see your doctor all the time, get yourself away, especially with vaccines for flu, get away from any sick people, and try to preserve your lung. Thank you very much for viewing this episode. I will meet you with the next episode, very important topics. Thank you for watching, I appreciate your time, and welcome always to Outpatient Clinic. Thank you.